Blood clots can form in the blood vessels draining deoxygenated blood from various parts of the body, veins. This most commonly occurs in the deep veins of the legs, that too when one is bedridden after an operation or an acute illness. It is noted in women taking rest after childbirth as well. On rare occasions, clots can occur in the deep veins of the upper limbs, much rarer than in lower limbs. Pain and swelling of the limb involved is the most common symptom in deep vein thrombosis. The limb may become very much swollen in certain cases with a color change to bluish red. Sometimes deep vein thrombosis may manifest without pain and even swelling. It may manifest with only mild swelling of the limb. Migration of clots from veins to the lungs is the most dreaded complication of clots in deep veins. If a large amount of clots migrate to the blood vessels of the lungs, pulmonary arteries, they can get blocked, producing breathlessness, chest pain, dizziness, and sometimes spitting out of small quantities of blood. In extreme cases, pulmonary embolism can be immediately fatal if the main pulmonary artery is suddenly blocked, preventing deoxygenated blood from entering the lungs for oxygenation. Prevention of clots in deep veins is more important than treatment. Ensuring good mobility of the lower limbs while bedridden is the most easy method of prevention of clots forming in the veins. This can be done by encouraging the individual to move the lower limbs frequently while in bed as much as permissible by the medical condition. If one is not able to move on one's own, a helper can move the limbs passively. Another method used in hospitals is to give intermittent pneumatic compression using a cuff and a motorized device. Yet another method is to provide elastic compression stockings. In addition to these measures, when medical condition permits, medications which reduce the clotting tendency of blood can be given. But these medications have the inherent risk of bleeding from the wounds in case of operations.